This presentation has been developed as part of the Embrace HE program and refers to prevention intervention practices on well-being for students in higher education. My name is Yota Dimitropoulou and I serve as an Assistant Professor of Educational Psychology at the Department of Psychology of the University of Crete in Greece. At the beginning, we will focus on some facts related to students' mental health as they are described in the relevant literature. University and college students are considered at high risk of developing common mental health problems. They usually encounter many stressors and transitional events, such as leaving home, families and friends, to move to another place where the university is located, or financial issues for covering the necessary fees, or adjustment problems in their effort to find their place and space in a new environment. Furthermore, students are within the age range when these mental health problems are at the peak of their development. But which are the most common mental health problems? Authors refer most frequently to internalizing disorders with high comorbidity, such as depression, anxiety disorder, obsessive-compulsive disorder, and post-traumatic stress disorder. In addition, university students may face an array of academic, interpersonal, financial, and cultural challenges. These challenges may go beyond students' resources and capacity to effectively cope, leading to academic struggles, a decrease in the quality of life, and a general dissatisfaction. This could cause the emergence of more severe problems related to students' health and mental health. Taking into consideration the aforementioned, how we could respond effectively on students' mental health needs. The mental health challenges faced by university college students call for the development of prevention intervention practices aiming at the promotion of their well-being. As already have been pointed out in the toolkit, these practices could be implemented on different levels according to the severity of problems. Based on research, two main strategies have been highlighted as central for the delivery of satisfactory outcomes on students' mental health after implementation: psychoeducation and skills training. In the following slides, we will analyze some of the main features and elements of these strategies. Starting from psychoeducation, it includes the following: the provision of students with accurate information about the potential problems or challenges they are likely to experience during their educational careers, their motivation to act properly, and taking action to resolve problems as they emerge. Some psychoeducational programs also offer opportunities for group discussion so that students have the chance to share their personal experiences, receive support or encouragement from others, and recognize that their personal experiences are not unique. About skills training, we refer to interventions that often employ various behavioral or cognitive behavioral techniques to build skills through the following process. The first step is defining the skills and explaining why they are important. Then we have the usage of repeating series of activities that teach these skills through modeling. A behavioral rehearsal and feedback are following, and the last step includes more practice until mastery is achieved. In other words, students could be trained on behavioral skills preventing negative outcomes such as stress, depression, or anxiety, and how to apply new skills. Another important issue that we will present are evidence-based interventions. Depending on their specific aims, interventions typically emphasize procedures such as cognitive restructuring, relaxation, mindfulness, conflict resolution, various coping strategies, and effective communication. Interventions can be delivered individually, in a group, in a guided self-help, or internet-based format. They differ from each other with regard to content, methods, and results. In the current slide, we can see some types of evidence-based intervention highlighted on reviews and meta-analysis. These interventions are mindfulness-based, cognitive behavioral, technology-delivered, psychoeducation, educational personalized male feedback, recreation programs, acceptance commitment training, setting-based approach intervention, suicide prevention, and other. Next, we will present two examples of prevention programs and practices. Several studies support that cognitive behavioral and mindfulness-based interventions have been effective in reducing psychological distress in the form of anxiety or depression in university students. One unified model is acceptance and commitment therapy, which is a trust diagnostic approach that focuses on increasing psychological flexibility by emphasizing acceptance, mindfulness, and values-based processes. In the context of the university, an online, ACT-based program entitled Student Compass was developed to enhance the well-being of students. The Student Compass is a web-based well-being and life skills program offering practical tools for enhancing psychological and emotional well-being, addressing motivation challenges, adjustment, stress-related issues, and promoting overall well-being. It has been adopted by many universities, such as the University of Jyväskylä in Finland. Students can use the program with or without coach support. More specifically, the program aims to promote good mental health and well-being, and therefore aiming to prevent mental illness, to encourage self-development and self-care, to help students cope more effectively with study-related challenges such as difficulties in concentrating and completing tasks, worries about graduating, and any other motivation-related issues, to provide strategies to work through life challenges more effectively, to prevent and address stress, anxiety, and mood-related problems, and finally, to provide individualized, meaningful, and relevant to each student's needs support. The Semi Healthy Campus Initiative, centered at UCLA, is home to 7 pods of well-being: Eat Well, Mind Well, Move Well, Research Well, Be Well, Engage Well, and Breathe Well. Started in 2012, its Healthy Campus Initiative strives to make the healthy choice an easy choice. Each pod is home to its own programming and initiatives, open committee meetings, and website. The Engage Well pod, for example, aims to promote healthy social relationships at UCLA. Social relationships on campus have many forms, including pairs, small and large social groups, work and living units, and the campus community as a whole. The specific pod goals are to foster a new social connection at UCLA through many venues across diverse groups of people and for many purposes such as education, service, dialogue, and enjoyment. Also, to enhance the quality of existing relationships, for example, through learning better relationship skills and current evidence on compassion and empathy, and stronger sense of belonging. And finally, to promote positive social behaviors on campus, including civility, acceptance, and inclusiveness. Apart from the prevention programs and practices, we will see some examples of evidence-based intervention programs. At the University of Cambridge, students can join an 8-week mindfulness course, the Mindfulness Skills for Students, which is an evidence-based intervention that consists of secular face-to-face group-based skills training program. The particular course aims to optimize well-being and resilience for all students and is not specifically developed for those with distress in a clinical range. 7 courses run in parallel during university terms, all delivered by an experienced and certified mindfulness teacher. The 8 weekly sessions last 75 to 90 minutes. Sessions include mindfulness meditation exercises, periods of reflection and inquiry, interactive exercises and home exercises. Research conducted at Cambridge University into the positive effects of mindfulness for students has shown significant benefits. Even during the exam term, students were less stressed and more resilient. Another important example of evidence-based interventions is the Uni Wellbeing course, which is an ICBT program for university students experiencing symptoms of stress, anxiety, low mood and depression. The intervention is delivered with weekly support from a clinician. The Uni Wellbeing course is based on the principles of CBT and systematically teaches information and core psychological skills that help students to understand their experiences of anxiety and depression and to start to manage their symptoms. It comprises materials presented in a didactic form, for example, text-based instructions and information combined with case-enhanced learning examples, for example, detailed case studies. Case-enhanced learning uses educational stories that identify a problem and a solution that a case study resolves. Last but not least, the Australian National Project Enhancing University Students' Wellbeing proposed a whole-of-university settings approach to promote mental health and well-being in a university environment. An environmental or settings approach to mental health understands well-being and distress to be products of individual resources in combination with the positive experiences and stressor in their environments. In a university context, this approach recognizes the impact of teaching and learning environment to students' mental health and well-being. The main aim of the project is to build the capacity of academic educators to design curriculum and create teaching and learning environments in this direction. This project supports sector-wide conversation, a whole-of-institution approach and pedagogical innovations, enabling all students to realize their academic potential. It is of high importance of involving students in the co-creation of university policies, programs and activity related to their mental health, given that user empowerment, self-determination and autonomy are key elements of successful health promotion programs. Thank you very much for your attention.